Addressing social determinants of health is especially important for Americans on Medicare Advantage. According to a recent report by Avalier Health, these beneficiaries are increasingly affected by a lack of services targeting access to things like quality housing, food, and transportation. So joining us to explain how to provide all those necessities is Chief Executive Officer of Oak Street Health, Mike Pykosz. Oak Street Health is a network of primary care practices for adults who utilize Medicare. Thank you so much for being with us, Mike.
Thank you for having me. Appreciate it.
So a lot of experts say that one of the important level setters for the future of Medicare is really looking at the socioeconomic disparities that impact who gets care, the kind of care they get, and when they get it. How big of a challenge is that for Medicare?
It's a huge challenge, and I feel like the word now is social factors and social determinants, but for us at Oak Street, what it really boils down to is what are the practical things or things in a person's life that's going to get in the way of them getting the health care they need and really achieving the well-being they need overall. And a lot of times the system's set up for dealing with acute episodes or optimized around what's reimbursable in a fee-for-service world, and those aren't the things people need to actually keep healthy. And so we see all the time the reason patients aren't getting the care they need, especially when you're talking about lower-income seniors, isn't because there's not a doctor who can prescribe the right medication. It's all the things that get in the way of them getting the doctor in the first place, or all the things that get in the way of them taking their medication correctly. And so removing those barriers is such a huge part of actually raising the quality of care for patients who really need it.
So give us some specifics here. How do those social factors impact a person's ability to get care? What sorts of things would get in the way of getting to the doctor or taking that medicine?
Again, it's very practical things like transportation. How do you get to the doctor's office if you're an older adult without family in the area, if you're not able to drive? Just getting there. So at Oak Street, for example, we offer transportation for our patients for free. And about 60% of our patients take a green van to and from their appointment every appointment. And again, we'd much rather take a patient in a van and incur that cost to get them to their appointment, get them seen by their provider, as opposed to them not going to get to the doctor and then an acute episode to happen. Now they're calling 911 and now they're getting a ride to the hospital, which is obviously not what patients need and not what the system.
And how does the cost work out? Because obviously providing those services is expensive, but is that made up for, on the other hand, by not having those acute episodes, which can be much more costly?
Yeah, it really comes down to how Oak Street is paid for what we do, which is very different than the vast majority of healthcare. So as you know, most of healthcare and most of Medicare is fee for service. You see a patient, you bill a code, and you get paid for that visit. And at Oak Street Health, we feel like that's not the way we need to be operating to really provide the care patients need. And so we are at the extreme of what people are calling value-based care or accountable care. We take what's generally called risk-based contracting, or essentially we take financial responsibility for all of our patients' medical costs, whether that happens at Oak Street Health or happens somewhere else, like a hospitalization or post-acute. And by doing that, we can not worry about what services are fee-for-service reimbursable. We can worry about what services are going to keep patients healthier. And the reality is the vast majority of spend for Medicare patients, 60+% of the spend is on acute episodes, on hospitalizations. And you don't want them, right? That's what we're trying to avoid. We want to keep people healthy and out of the hospital. And so we can invest a lot more resources up front, more time with the doctor, team-based care, behavioral health, transportation like we talked about, and a whole host of other investments in their care. And as long as those investments are actually keep patients healthy and out of the hospital, we can keep that savings easy to pay for all the extra stuff we're doing for patients. And so that economic model we have really allows us to focus on what patients need as opposed to what's reimbursable.
I mean, that makes a lot of sense to me, but have you actually seen improved outcomes for patients?
Absolutely. We're incredibly proud of what we've accomplished. So we have reduced hospitalizations by over 45% for our patients. We have reduced readmissions substantially. We've reduced ER usage by almost 50%. And we have a net promoter score above 90%. So both the patient experience and the quality outcomes are just night and day better than what patients are experiencing otherwise.
So obviously a lot of Democrats are running for president on the idea of Medicare for all. There are some nuances in the different proposals, but in general, what's your view on Medicare for all, and how do you think it would impact patient care?
So to me, and again, keep in mind, all of our patients are already on Medicare, so expanding Medicare to different segments of the population has pretty little impact on Oak Street. I think when I look at the different proposals, I think really the devil's in the details. And I think when I look at what Oak Street's able to do for our patients, because they have Medicare, because they have access to insurance, we are able to make sure they have access to the care they need. But one of the things that has enabled Oak Street and made us successful is working through the Medicare Advantage program, because Medicare Advantage creates a cauldron for innovation. And so the reason we were able to do these, what I call risk-based contracts, but essentially the reason we can get paid for keeping patients healthier and really invest in their care is enabled by the Medicare Advantage program. And so one of the things, as we think about what to do, Medicare for all, or all these different components, I think it's important that we make sure we are enabling and allowing innovation to happen, because the Oak Street model, our results are much better. The care our patients are receiving is just differentially better than what the average patient's getting on Medicare. And we couldn't do that if we weren't able to get risk-based contracts. We couldn't do that if we weren't able to test new approaches. And hopefully there's a lot of other organizations that are testing new things as well that'll be as successful as Oak Street. I think that will allow us to improve the quality of care overall. And so to me, whatever form the future of healthcare takes, I think the important part is making sure we are allowing for innovation. We are allowing for different payment models. We're not just trying to constrain to one model, because the fee-for-service standard model is one of the reasons we're in this place where we are today, which is really high cost and really low quality.
Right. Well, Senator Sanders has probably been the leader in terms of the Medicare for all push and has specific legislation drafted. Do you know how Medicare Advantage fits into that? Is it addressed? Does it continue as it is?
My understanding is his plan is more extreme, where Medicare Advantage wouldn't be part of it. And I'm certainly no expert on Bernie Sanders' proposal, but again, for me, coming where we come from, and it's an organization that I think focuses a lot more on practically what can we do for our patients today, what can we do for our patients tomorrow, and where should we be investing to improve patient care. Any proposal, whether it's any of the different candidates or whoever, I think the biggest thing for us, and thing I would always focus on, is how do you make sure you're enabling organizations like Oak Street and other organizations that can create new models of care, can innovate, and can really align the incentives between patients and providers and the whole system. And I think healthcare, one of the things that I love about Oak Street Health and I love about healthcare overall is it's one of the few places where we can actually achieve higher quality, a better experience, and lower cost altogether. There's no trade-offs. And Oak Street Health has proven it, right? The quantitatively much better outcomes at Oak Street Health, quantitatively much better patient experience at Oak Street Health, much better experience for our providers as well, providing the care. It's a win-win-win for everyone. And again, it's at a lower cost and it's higher quality. And the challenge is actually navigating an incredibly complex, difficult system that's evolved over a long period of time, and really was set up in an era when there wasn't chronic conditions that need to be managed in a longitudinal way. The challenge with the system was about paying for acute episodes, and that has evolved as people have lived longer, as we've gotten more and more advances in medicine, and we've been able to prevent things like heart attacks. Now the challenge is different, and the system, the infrastructure, and the payment methodology hasn't evolved to match these new needs. And Oak Street Health has been able to, really through the Medicare Advantage program, through the innovation that's allowed, to create a much better way to align incentives, a much better way to be able to invest in the care patients need to keep them healthier and improve their experience. And I would hate to see something happen where we get in the way of that innovation, because I feel like there's a lot of that happening right now. And that's going to unlock so much higher quality care at a lower cost for our country.
Right, because as you're pointing out, in most areas, the model now, basically the incentives are to get people to, have as many sort of procedures as possible that can be, like, that's the model right now. And what you're talking about is, rather than focusing on the number of procedures or things that are done to the patient, like what is the patient's overall health outcomes, how do you change the system overall so that you have value-based care more central in terms of the whole country?
Well, I think we need to keep creating programs and incentives to push people towards those types of models. And I think we need to continue to find ways to empower and enable the groups that are doing it. And when we think about Oak Street Health, there's really two mega trends that people talk about in healthcare that I think we're really in the middle of and trying to take advantage of. And one is, what we've talked about, is value-based care, which is, hey, how can we pay people for value, not for volume? And if we can do that, that's going to drive people and send people to provide higher quality. So absolutely doing that at Oak Street. The other one is consumerism healthcare. And more, the way Oak Street works, we start all of our centers de novo from scratch. We go into areas and markets where we think there is a need for higher quality care, and we essentially tell people, here's what we do, here's what we can provide you, and here's why Oak Street Health is a great place to get your care. And a lot of what we find is the challenge isn't getting them to switch doctors. The challenge is helping them understand how the healthcare system works in the first place, helping them understand why preventive medicine is important. But by being able to approach them in a consumer-driven way, it's really putting the onus on people to vote with their feet to get the right type of care they need. And just like I think from a payment perspective, we should allow more innovation. I think from a consumer-driven perspective, we need to continue to empower groups and empower patients to make decisions based on where they can get the best care, where they can get the best experience, continue to let groups invest more and more dollars in the experience for patients. And what's going to happen is people are going to vote with their feet. And it's going to be a situation where people who want to stick to the old model of being paid for volume and not providing high quality care, not being accountable for outcomes, they're going to lose patients, and they're going to go to the places actually providing the experience and the quality care they need. And so, again, if I think about it from a policy perspective, those are the big things I want to keep enabling, right? Is keep allowing people to engage people in a consumer-driven way and remove the barriers to doing that.
Very interesting stuff, Mike. Thank you so much. Really appreciate your expertise.
Great, thank you.
We'll have more Rising after this.